All right, so welcome to part two of therapeutic agents for the nervous system. When we left off in part one, we learned about the components of the central nervous system. We learned about the CNS and the PNS. We also learned about the neurons and the nerve transmission. We learned about the brain stem, the spinal cord, the different uh, neurotransmitters inside of the sympathetic nervous system and the parasympathetic nervous system. And today we are going to continue learning about the conditions of the nervous system and their treatment. So when it comes to the somatic nervous system, there is a network of nerves that relay messages to the CNS from outside of the body, from the outside world, and then it returns the messages back to the body. So in part, um, the somatic nervous system is a part of the PNS, which remember the PNS represents the peripheral nervous system. And inside of the somatic nervous system, it helps by regulating the motor nerves that control voluntary actions of the skeletal muscles and impulses from the sensory receptors. So some examples of the receptor sites would include smell, taste, touch, as well as hearing. And so as we continue to learn more about the nervous system, we're going to get into some learning objectives of the conditions of the nervous system as well as their treatments. So based on this portion of the presentation, some of the objectives we're going to be going over is you should be able to list the primary symptoms of conditions that's associated with dysfunction of the nervous system and the peripheral nervous system. You should also be able to recognize some drugs that's used in these treatments, conditions, and disorders, as well as being able to get familiar with the brand and generic names and be able to list appropriate auxiliary labels for filling the prescriptions with the medications that's associated within this chapter. You should also be able to discuss some conditions that's associated with the nervous system and some other clinical features. And you should also be able to get familiar with the brand and generic names of those medications. So let's first start talking about some of the conditions of the nervous system and their treatments. So there are many different disorders that involve excessive muscle contractions, uh, basically like a wasting away of muscles. And so based on some of the conditions, there are some that have no cause. Some could be brought on by hereditary, or some can just be random genetic mutations. So when it comes to the investigations of these conditions, some of them are environmental. And so we're going to discuss only a sample of the major indications and medications that treat the conditions of the nervous system. So one of the first conditions we're going to talk about is myasthenia gravis. So with this particular condition, it's a rare autoimmune disorder. It happens by having electrical impulses from the CNS to the muscles throughout the body, especially having a factor on the throat and the eyes. Those are the main two that are affected. Now, the cause of the myasthenia gravis is sometimes there's a tumor in the thymus, and so one of the common side effects of a person having this condition would be a drooping eyelid. And so, as we learned that it's a result of a muscle skeletal weakness, it affects the throat muscles, the eyes, and the eyelids, as well as voluntary facial muscle movement. And so, less commonly, the disease can affect other areas. So, there is some vocal and visual difficulties that might occur. And as a reminder, the eyelid drooping is common. So, basically, the muscles fatigue easily and it takes longer to recover. And so, in understanding more about the myasthenia gravis, there is a case where if a person has the chronic has this chronic, it's going to worsen over time. And with the respiratory system being affected, oftentimes death results. And so the main drug of treatment for a person experiencing a condition of myasthenia gravis is the drug class anticholinesterase. And so some of those medications will be going into. So like one of the medications is methicillin, and it's available by route of by mouth or injection. And so a person who has the condition of myasthenia gravis, they can go through surgery and they can remove their thymus if there's a tumor that's present. Unfortunately, there is no cure for myasthenia gravis except for where the cause is a tumor. So other medications that might be used for this condition would include Imuran. And so I mentioned one of the drug classes might be an anticholinesterase. So the class of drugs would be also cholinergic drugs. And this drug works by blocking the destruction of the neurotransmitter acetylcholine by the enzyme cholinesterase. And so the side effects can occur because of overstimulation, and some of the side effects of the medications for this condition would include nausea and vomiting, which, remember, the abbreviation for nausea and vomiting is NNV. Other side effects include diarrhea as well as severe abdominal pain. So now that we've talked about the conditions for myasthenia gravis and the drugs that help treat it, we're next going to talk about polyneuropathy. And so polyneuropathy is categorized by a distal loss of sensation. A person can also have burning and weakness. I have gone through a simulation of getting familiar with what a person might experience having neuropathy. And so think of like your funny bone being hit and you feel like this tingling sensation in your arm, or should I say in your elbow. Think of that tingling sensation all over, like that loss of sensation, and think of like a burning sensation as well, going all over your body. So with polyneuropathy, some people who are diabetic might experience this. And so diabetic neuropathy is a common side effect of certain medications. So this would include people having diabetes. Polyneuropathy can be brought on by people having diabetes, possible alcohol abuse, and there are also some certain medications that might have some adverse effects, among others, but diabetic neuropathy is the common form. So some ways to treat polyneuropathy. It is difficult to treat because, remember, it's something that affects the entire body and having that sensation. So some of the medications that's primarily used to treat this particular condition would include antidepressants, narcotic pain medications, as well as anesthetic medications. Now, one of the main medications that's used is Cymbalta, which works by inhibiting the reuptake of the serotonin and norepinephrine. You also have some non-drug treatments, some which include TENS, TENS, which is abbreviated for the transcutaneous electrical nerve stimulation. And so basically there is a daily foot inspection to prevent ulcers. And so in regards to other treatments for polyneuropathy, some of the medications would include Cymbalta, which we talked about. The generic of Cymbalta is duloxetine. Another example of a drug that helps with polyneuropathy would be Neurontin, which its generic is, let me see if you guys remember. What's the generic of Neurontin?
Gabapentin.
Yes, good job. Generic of Neurontin is gabapentin. And so the medication is commonly taken by mouth, and gabapentin comes in various strengths. So this would be one of the medications that would be treated for a person experiencing polyneuropathy. So now that we've talked about polyneuropathy, we'll next learn about epilepsy. So with epilepsy, a person experiences a seizure disorder, and so there is an excessive high uh, hyperexcitability of the nerve cells in the brain. And so a person who experiences the condition of epilepsy would have to be diagnosed based on a EEG. And now when you think of epilepsy, you should know that there are two types of seizures. You have a partial seizure and then a generalized seizure. Now with a partial seizure, that affects only one hemisphere of the brain. So the person who goes through that would have a twitching of the limb, but that person would experience no loss of consciousness. And then a person who experiences a generalized seizure, that affects both hemispheres. And so when it comes to the seizures, there are different levels of intensity. And so the least violent is considered the petit mal, and the more intense or the more longer the seizure is going to be a grand mal. And so when it comes to the as far as children, the petit mal is one that they experience, and that's the least violent. And so, an example of when a person goes into the example of when a child might go into a seizure, one of the effects that you can kind of see is the person stares off into space for long periods of time. And so, in the grand mal seizure, you should know is also known as a tonic clonic seizure, and the person loses consciousness and falls to the ground. So the differences between the petit mal and the grand mal, the petit mal is the least violent and the grand mal lasts longer. But with the grand mal seizure, that person is going to lose consciousness and may also fall to the ground. So if a person is experiencing seizures, injuries can occur, and it really depends on where and when the seizure is taking place. So if you ever encounter someone having a seizure, it's always encouraged that you move any objects away from the person. There are even videos that you can even find on YouTube that represents some training as far as having the person lay on their side so they don't swallow their tongue. There's another type of way of handling such conditions, but uh, epilepsy is a seizure disorder, and some of the medications that help treat the epilepsy would include medication by the name of Tegretol, which its generic is carbamazepine. Another example of a drug that treats epilepsy and the partial seizures would include a drug by the name of Dilantin, which its generic is phenytoin. So there are some other causes of epilepsy besides just a person experiencing a seizure. A person could experience uh, a seizure disorder based on them having a skull fracture. Maybe they was in some type of accident, or a person having a tumor. Now, when it comes to the treatments, a person can take either drugs or they can have surgery. And the only reason to have surgery is so that the physician can operate on the tumor. So the drugs types, the drug classes that's going to treat epilepsy is going to be anticonvulsants. And so with a person who experiences epilepsy, they're going to take the medication on time every single day at the same time. And so you should know with epilepsy, unfortunately, there is no cure, but many people who are epileptic live a relatively normal life with drug treatment or with surgical interventions. Um, it's important that women who have seizures should always um, speak to their doctor, especially when they become pregnant, in regards to the medications that they're taking and the risk that it can cause to the fetus. So, going more in depth regarding the drug treatments for epilepsy, we'll learn that anticonvulsants work by inhibiting the impulses within the central nervous system by inhibiting one or more of the ions. Those ions include sodium, calcium, and potassium. So, A person taking the medications, the correct doses could help by stopping the seizures. And so the medications are going to be in various agents that could be chosen. So we talked about anticonvulsants, but some other drug choices as far as drug classes would be benzodiazepines, barbiturates, or even hydantoins, just using those for example. So those are more of the pharmacological class, but the therapy would represent it belongs to an anticonvulsant. So now that we've talked about epilepsy and understanding the different types of seizures that there are, we're next going to learn about the Alzheimer's disease. Now, this particular disease is a degenerative brain condition, and it progresses as one ages, but it can also occur in younger people. And so with a person having Alzheimer's disease, there is a such thing as different categories. You have early stage, mid stage, and late stage. Now, with a person experiencing the Alzheimer's disease, there is a loss of neuronal synapses. So basically, the information from the memory bank gets lost. Now, a person who suffers from Alzheimer's disease, the person can't process information uh, as they used to, or that's where the memory loss occurs. So with Alzheimer's disease, um, not all patients experience the onset and the progression of Alzheimer's disease similarly. However, the disease progression classification can help the family and the doctor monitor the disease severity. And additionally, there are 7 specific stages that describe the Alzheimer's disease progression. You should know that the abbreviation for Alzheimer's disease is AD. And so, with the prognosis, the medications work by slowing the AD progression in some cases. However, there are no treatments that stop the progression completely. So it is at this moment not a cure for a person who experiences Alzheimer's disease. And with it, we understand that it's a degenerative brain condition. So this is going to result in the patient having some memory loss, some severe confusion, impaired judgment, personality changes, disorientation, and there is even the possible effect of a person experiencing a loss of language skills. So a person can forget to, like, literally forget how to speak. There are even movies you might be familiar with if you've ever seen the movie The Notebook. I'm not giving the movie away, but if you watch the first 5 minutes, you can tell the person uh, has issues with remembering, and so that person suffers from Alzheimer's, using that as an example. So continuing learning about Alzheimer's disease, the brain cells are replaced by deposits of proteins, and so there is basically tangles and knots. And so the brain actually shrinks in size, and so that's why the memory is affected. And so a more um, a more, I like to say, intense part of Alzheimer's disease is a person having dementia. And that's an abnormal loss of memory and basic mental function. That's where that occurs. So there are some other symptoms, which could include the inability to perform normally familiar tasks. The person can have difficulty talking, or the person can have disorientation in familiar surroundings. Um, there's another idea as far as movies or TV shows that I like to use as an example. If anybody watches the TV show This Is Us, Rebecca is, I don't know if anyone does. Well, let me just leave that there because I don't know if anyone has watched the season. But there are different examples of how to see how a person actually goes through Alzheimer's disease. And there are even some videos that associate with the proper caring, or how caregivers can also interact with their loved ones who are going through this particular condition. So the drug treatment for the Alzheimer's disease is going to include patients taking medications, or if the family is really having a difficult time with the patient, because remember, the patient's going to have some severe memory loss, confusion, and disorientation, personality changes. If that becomes too much for the family might actually put the person in a skilled nursing facility. So some of the main therapy that a patient would take for the drug treatment of Alzheimer's disease would include a cholinesterase inhibitor. An example of that would be donazepam and memantine. Who can tell me the brand name of memantine?
Namenda.
Yes, correct. Namenda. Namenda is the brand name of memantine. So as a reminder, Namenda, memantine is for memory loss and for the drug treatment of Alzheimer's disease. So now that we've learned about Alzheimer's disease, we'll next learn about Parkinson's disease. So the abbreviation for Parkinson's disease is PD. And so with Parkinson's disease, it's a loss or a deficiency of the dopamine. And so inside of our brains, we have our serotonin levels, we have our dopamine, and with a person experiencing Parkinson's disease, there's a loss or a deficiency of dopamine. And so there is an effect on the basal ganglia, which is the group of cells which is located in the medulla, which is considered the white matter of the cerebrum. And so the function, person who's experiences the Parkinson's disease, uh, it affects their function of the regulation of their muscle tone and their body movement. So a person who has Parkinson's disease is going to have what's called tremors, as well as rigidity. So it's like continuous shaking. Now, with the dopamine, it is known as a natural chemical in the brain that inhibits movement. Now, acetylcholine, it activates the neurons and the dopamine and activates them. So when a person has a lack of dopamine, they're going to have movement without ending. Now, to give you an idea, or should I say a visual of what Parkinson's disease looks like, you may remember famous actor Michael J. Fox. He suffers from Parkinson's disease. Another person who suffered from Parkinson's disease was the great Muhammad Ali. And so, if you ever remember seeing him in interviews over time, you would kind of see the tremoring and the rigidity. And so, remember, Parkinson's disease is going to affect the person's um, body movement. And so, because of the lack of dopamine, they're going to have movement without ending. So when it comes to Parkinson's disease, there are severe symptoms that increases over the years. So I talked about some of the symptoms, meaning the tremors and the rigidity. Other common symptoms would include a loss of balance. The person would have hypokinesia or bradykinesia. And so with these particular symptoms of the Parkinson's disease, a person could have stoop posture, uh, their hips and knees are slightly flexed. They are also known to take more short shuffling steps because they can't move and glide like they used to. So you hear me talking about bradykinesia, and basically with bradykinesia, it's known for a combination of tremor, rigidity, um, and postural instability. So over time, the physical movement slows in the person who has Parkinson's disease, and they can become wheelchair bound. And so they also experience other problems, for example, like swallowing and speech difficulties. They also experience constipation and cognitive impairment. Those are some of the things that come with Parkinson's disease. And so, with the diagnosis, it's difficult because of the slow progression. Remember, it increases over time. And so, some of the treatment for a person experiencing Parkinson's disease would include surgery, physical therapy, as well as drugs. And the medications that would be prescribed would be used to increase the dopamine and acetylcholine levels in the brain. However, as a reminder, any drug that is taken, you have to keep in mind all drugs have side effects. So even a person who is being prescribed a medication for Parkinson's, those drugs are going to have some major side effects. And so some of the medications that would be for Parkinson's disease, one of the main drugs of choice for Parkinson's disease would be levodopa carbidopa. Its brand name is Cinemet. Some other medications for uh, Parkinson's disease would be Congentin. And who can tell me what the generic of Congentin is?
What is the
Benzatripine.
benzaprine? Yeah.
Yes, benztropine.
That's
Hmm.
benzatripine.
Good job. And
I just
again, all of these medications that we're talking about today, all of those medications still have side effects. So some of the side effects of benztropine, like blurred vision, or even dry mouth. So these are just some of the examples of Parkinson's disease and the drugs that treat that. So now that we've talked about Parkinson's disease, we're going to move into the next condition, which is multiple sclerosis. You should know the abbreviation for multiple sclerosis is MS, and multiple sclerosis is a deterioration of the myelin sheath. Remember, our myelin sheath is inside of our brain, and so with the multiple sclerosis, uh, person, well, let me further first go into uh, the effects of the multiple sclerosis. So we talked about the myelin sheath is affected. So our myelin sheath actually insulates the surrounding of our neurons. And so the sheath is replaced by a sclerotic tissue, like a hard tissue. And so the electrical impulses cannot pass through. And so no movement is completed. So with multiple sclerosis, the average onset is the age 30. And there are some symptoms of multiple sclerosis, which include muscle weakness, abdominal sensations. A person can feel like numbness or tingling. They can also experience vision loss, vision change, or a loss in coordination. Now, patients who experience MS experience periods of remission that's followed by an attack of loss of function. And so, multiple sclerosis is the cause of it is an autoimmune disease. And so, with multiple sclerosis, you have different patterns. A person can have a primary uh, progression of it, and so people who are diagnosed with that particular type of multiple sclerosis have slowly worsening neurological functions from the onset of the disease, and approximately like 10% of people with multiple sclerosis have that pattern. One of the highest one of the highest medications that would be used for multiple sclerosis would be um, beta-seron, which its generic name is interferon beta 1B. And so this would be provided via subcutaneous injection. So it would be a parenteral dosage form. Now, the medications for multiple sclerosis, there is a first line of treatment, which for the disease modifying immunotherapy to slow and minimize the progression of the disease. The second line of treatment would be for a person to have steroids, and this would basically given to treat the flare-ups that can last anywhere from 1 to 3 months. And so I've gone over an example of a medication that's used to treat multiple sclerosis. Another example would be Rebif, and that is interferon beta 1A, and that is also by route of subcutaneous injection. So now that I've talked about some of the conditions, we've talked about multiple sclerosis, we've talked about Parkinson's disease, We talked about Alzheimer's disease. We talked about polyneuropathy. The next condition of the nervous system I'm going to talk about is a person experiencing migraine headaches. And so with a person experiencing migraine headaches, this is going to happen based on a range of triggers. It could be anywhere from hormonal changes, food, stress, bright lights, or other changes in the environment. So what happens when a person experiences a migraine headache? Well, their serotonin levels drop, and this releases the neuropeptides that travel to the meninges, or they cause the blood vessels to become dilated and inflamed. Currently, there is no cure for a migraine headache. However, there are some preventative measures that a person could take that could be exercising, creating more oxygen, creating release of stressors. Another preventative measure for migraine headache would be for a person to avoid the triggers. So, if it's a certain food that gives a person a headache or a migraine headache, or if it's stress, stress kills, believe it or not. So we have to start putting ourselves in positions where we're not triggering these things is going to cause some health problems. So some of the treatment for migraine headache, I mentioned some of the non-drug treatments, which would be avoiding the triggers or exercising. But as far as medications go, the first line of treatment would be an NSAID. You should know NSAID is the abbreviation for non-steroidal anti-inflammatory drug. Another example of an NSAID would be an example of an NSAID would be ibuprofen or Aleve. Those are over-the-counter items, but just wanted to give you an example of that. Another first line of treatment could be aspirin. Now, if a person is experiencing severe migraines, they might take triptans. So there is a drug called sumatriptan, which is the generic name of Imitrex. And so that is commonly used for migraine headaches. But that's used if a person has severe migraines. A person might take pain relievers, and then a person could also take preventative medications such as a beta blocker, a calcium channel blocker, or an antidepressant. So some other medications for migraines, an example would be Replex, which its generic is elatriptan, as an example. So now that I've talked about migraine headaches, I'm next going to talk about a stroke. And so last week we learned in the cardiovascular system, a heart attack is where there is a blood clot from the heart. A stroke is where there is a blood clot or some type of disrupted blood flow going to the brain. So with a stroke, it could be due to ischemia or hemorrhage. So the prognosis is dependent on the severity of the damage to the brain. And so a person who experiences a stroke, they could have physical and or speech therapy, which is often necessary to regain the ability to function. Now, some symptoms of a person who's had a stroke would be slurred speech, headache, dizziness, loss of use, or weakness on one side, and then the person can also have some visual problems. I will share with you a personal story about myself. When my mother was 7 months pregnant with me, she suffered a stroke. And so one side of her entire body she actually lost that function. And after months of therapy and even speech therapy, she, regained all of her skills. And so every time I get ready to talk about the effects of a stroke or some of the symptoms or what a person goes through after they've suffered a stroke, it's really near and dear to me because I consider myself a miracle child because my mom was pregnant with me while having a stroke. And so there are some some challenges that a person might have after enduring that. And so us as healthcare professionals, you being pharmacy technicians in training right now, you never know who you're going to come across and what things they've been through, especially medically. So it's always important to show empathy to patients and even their healthcare team, such as their family members. You just never know what someone's really going through. So some of the medications for the drug treatment of strokes would include antithrombotic medications, Remember, anytime you hear thrombotic, you should think of blood clot. So antithrombotic represents a block of the blood clot. So drug treatments for strokes, there's a there are some medications that would work by lowering cholesterol and high blood pressure, because when there is a buildup, I'm using cholesterol as an example, or even high blood pressure, when there is a buildup, is going to make the body work just that harder just to get the blood to pumping. So there are medications that might be used to lower a person's cholesterol and blood pressure. Now, with stroke prevention, doctors usually tell patients to take a low dose aspirin daily, and that would be a strength of 81 milligrams. And so you may have heard of the phrase, one aspirin a day keeps the doctor away. I'm not sure if you've ever heard of that. But as a pharmacy technician, you might often see patients ask you, where's the aspirin? Because they're used to taking aspirin 81 milligrams every single day to prevent a stroke, because the aspirin works as a thinner to the blood. And so it's very important, please write this as a note, it's very important to understand, for a person who is already on a blood thinner, I'll use an example, warfarin. If they're already on a blood thinner, it's going to be very important that you, as the pharmacy technician, alert the pharmacist if they're coming to pick up warfarin and they have also picked up aspirin. That's an important flag to make sure you inform the pharmacist that they're picking up aspirin as well as their warfarin, so that the pharmacist can counsel them, because maybe the doctor told them to, but that's something that should definitely be mentioned. So we talked about a lot of different disorders. I'm going to wrap up talking about depression and its treatment. Now, when it comes to depression, there's a range in severity from minor to major. The most major thought of depression is thoughts of suicide. And so with the major range of depression, it's difficult to treat and it interferes with a person's normal function. So some treatment of a person going through depression might be psychotherapy, or even behavioral or cognitive therapy. Now, there are different drugs that will help with depression, different classes. Examples of the drug classes would be SSRIs, SNRIs, TCAs, and MAOIs. So all of those are different drug classes. SSRIs is selective serotonin reuptake inhibitor. SNRIs are serotonin and norepinephrine reuptake inhibitors. TCAs are tricyclic antidepressants, and MAOIs stand for monoamine oxidase inhibitors. You will notice if you go to any pharmacy and you pick up a medication over the counter, a majority of them says, do not take with MAOIs. So we're going to get into some examples of what those drugs represent. So some of the examples of a MAOI would be Nardil, and its medication is phenelzine. That's the generic, phenelzine. And so we talked about a little bit of depression, and its ranges from minor to major. Some of the other medications, as far as like a SNRI, an example of that would be Cymbalta. We learned about Cymbalta earlier. And then there's another SNRI, and its example would be Effexor. Can anybody tell me what the generic of Effexor is?
Venlafaxine.
Venlafaxine. Great. And so that's just some of them. And we'll continue to go over more of the medications that help treat depression. But another condition would be an anxiety disorder. And so with anxiety disorders, you have different types. You have OCD, you have PTSD. With OCD, that's a person experiencing panic disorders or phobias, or maybe they have obsessive compulsive disorder. PTSD, there are different types. Some are generalized and some could be like social anxiety disorders, a person experiencing phobias, panic disorder, and PTSD stands for post-traumatic stress disorder. There is a myth. A lot of people think only people from the military are the only ones who suffer from PTSD, but there are different types. There are people who have social anxiety, and that can be caused by PTSD. Or if you've ever been in a car accident, your next time getting in a car is going to be very different. Like, I'm just telling you now. So, like, there are different forms of PTSD. The treatments of anxiety disorder is going to include psychotherapy, behavioral agents, or as far as medication goes, anti-anxiety agents. And so with examples of anxiety medications, a medication that could be used would be Xanax. Can anybody tell me what the generic of Xanax is?
Aprazolam.
Alprazolam. That's one of the examples. So we talked about depression. We talked about anxiety disorders. Next, we're going to talk about the bipolar disorder. And so with a person experiencing bipolar disorder, they may have some symptoms, which include excessive mood swings. And so some of the treatment for a person experiencing a bipolar disorder would include them taking a mood stabilizing agent. An example of that would be lithium. A person who's experiencing bipolar disorders could also take anticonvulsants such as Tegretol, which its generic is carbamazepine, or they can take Depakote, which its generic is Valproate. There are many medications that's going to treat the nervous system when it comes to the conditions that we talked about today. So lastly, on today's lecture, I'm going to talk about the nervous condition called schizophrenia. And so schizophrenia is basically episodes of psychosis. A person will experience delusions, they'll have impaired social function, is where the person has disorganized thought and speech, and the diagnosis is difficult. Another condition of the nervous system would include insomnia, and there are three factors that has to be present to be diagnosed. Uh, the person cannot initiate sleep, they can't maintain sleep, or they wake up too early. And so this occurs even if there's an ample opportunity to sleep. And it also, a person who's experiencing insomnia, it impairs their daytime function. So a medication that a prescriber might prescribe for insomnia might include Ambien, which its generic is Zolpidem, just giving that as an example. So we talked about a few different conditions of the nervous system. We talked about schizophrenia. We talked about bipolar disorder. We talked about anxiety disorder. We talked about depression. We talked about migraine headache. We talked about stroke. We talked about multiple sclerosis. We talked about Parkinson's disease. We talked about Alzheimer's disease. And we talked about epilepsy, polyneuropathy, and Myasthenia gravis. In conclusion of the conditions of the nervous system and their treatments, we're going to talk about the ADD, ADHD. So ADD is an attention deficit disorder, whereas ADHD is the attention deficit hyperactivity disorder. A person who has this condition has difficulty focusing, and boys are 3 times as likely to be affected. It usually is diagnosed in school-age children, and one of the common effects of the ADD would include a person doing some excessive daydreaming. Um, Another fact about me, when I was in second grade, I was diagnosed with ADHD. So even to this day, I have difficulty focusing. However, with much time and attention, I have really developed a system, and that's why even when I am in school or when I have to study, I really have to take extra time to get it, because I do have a focusing issue. But with a person having ADD or ADHD, a person could choose either to take medications, depending on the diagnosis, and some of the medications that help treat ADD or ADHD would be medication called Adderall or Vyvanse or Ritalin. These are three of the main drugs that's often prescribed. And lastly, completing the nervous system, we're going to talk about smoking cessation. What you should know is anytime you see smoking cessation, that means a person wanting to quit smoking. So a person wanting to quit smoking, it is a difficult process that the pharmacy staff might be involved with. The pharmacist might help the patient by recommending over-the-counter products such as nicotine gum or nicotine patches. The pharmacist can also work by providing counseling, and if the patient has a prescription for a medication that helps with smoking cessation, such as Chantix or Zyban. An example of Zyban would be bupropion or Wellbutrin. Example is bupropion. These are two medications that can help a person quit smoking, and the pharmacy might even be encouraged, as far as a pharmacy technician, they might be encouraged to ask the patient, are they smoking or are they looking for help to quit smoking? So I worked in a pharmacy before where that was a question we would have to ask patients so that we can offer the patient to speak to the pharmacist for counseling on quitting smoking. And that is going to conclude the lecture on the therapeutic agents for the nervous system. This was part 2.